doctor. Oh, man, I almost lost it for a second. I thought it was a patient. Oh, whoa. I was dreaming from it. Wow, okay. I don't know, guys, but welcome to today's video. We're doing nasal cannula today, and it's really simple video unpacked. One oxygen device to look at, to go over, and that is nasal cannula. This is the most encountered device that we have. You can eat with this device. There are a few things that we need to know about this device, and that we'll cover today. But really, guys, this is the one you're going to be encountered with the most in your clinical settings, all right? So we should know a lot about it, right? Nasal cannula, right? Prongs, right? We know the positioning. Prongs this way, go like snakes, right? Prongs down, we'll put it, loop around the ears, keep it in front. No choking hazards, no putting around the neck, they fall out of bed. And you get it, right? So we know the placement, but that's not what we're here solely for. We're gonna talk about it. In this category, we're at leader flows. We should know that our nasal cannula, and we're talking adults here, we're talking adults, okay? That we are looking at the leader flow from 1 to 6 liters. That's what we're looking at here. So 1 to 6 liters a minute. That's what we're looking at for a nasal cannula, 1 to 6 liters, okay? We have another video out there, it's called Oxygen Devices. Watch that. It will include the nasal cannula and actually unpack it a little bit over there as well, but this is a different video. All right, so liter flow, 1 to 6. We see it already here, 1 to 6 liters. All right, what is that FiO2? Well, it's very easy, guys. 24, and we just keep going up by 4. Okay? Just keep going up by 4. Okay? All right, and I'm going to write this here, 44%, but I'm really going to, as soon as I write it, I don't want that. I'm really going to say this 40% is that category. But to keep this simple and to fall in line, we are going to stay with the 1 through 6. But this is the science behind it. The science behind after 5 liters, because we need to know this is not a precise FiO2, right? If you watch that other video, you see what that means. But this is a variable FiO2. These are estimated. You will not chart that the patient received 28% because you had them on 2 liters. You would chart 2 liters nasal cannula. That's what you chart. But you, as a clinician, need to know that it's an approximate 28% that you're delivering to that patient or trying to achieve. But there's a lot of things that are in there. Nair size, if it's too closed, they'll get more. If it's not, how much are they mouth breathing? All these things can dilute the oxygen or make it more, right? So after 40, the science shows that it's so off that not even an estimate of 44 falls in line. So at 40, closest that we'll get, and you can go, but for terms of schoolies, keep it in 4 to 40, 44, but just understand it goes up to approximately 40%. That the variable at the 6 liters is so off that you can't really say 44%, okay? So it's that easy. 1 liter, 24. 2 liters, 28%, 3 liters, 32%, 4 liters, 36%, 5 liters, 40%, 6 liters, 44%, right? So it's just go by 4. If you know where to start, right, then you know where to go, right? Up 4. So if I ask you, what's 3 liters nasal cannula? 32. Or if you remember 24, you go 2 liters is 28, but you'll need to know that, okay, guys? The thing that I want to point out here is the 4 liters. 4 liters. So let's talk about some stuff with the nasal cannula. The nasal cannula that you need to look out for, right? Okay, we talked about the positives. You can eat with the nasal cannula. You can talk. It doesn't feel claustrophobic for the patients. But there are some things that you need to watch out with your patient, and that could be dryness, nares drying out, bleeding, cracking because of the flow of the oxygen being a dry gas going over that. It will now start to dry. It could crack, cause some bleeding, some discomfort. You walk in there, the patient has their nasal cannula off. It's just so uncomfortable. I can't read it, nosebleed, whatever that is, right? Well, At 4 liters, we have a thing that we can help them out, and that is called a bubble humidifier. So AARC guidelines, at 4 liters, we must put a bubble humidifier on a nasal cannula. So if it's 4 liters or above, you automatically include this bubble humidifier. All right, but let's say you're at 1, 2, 3, any of these levels here, right? And you walk in, your patient has it off and they're feeling some discomfort and bleeding, all those things we talk about. You can recommend a bubble humidifier. You should put on a bubble humidifier. If the test question asks you, add a bubble humidifier. Okay. One thing with the bubble humidifier, guys, that I've seen that a lot of people get confused on, this is solely nasal cannula. You do not put a bubble humidifier on a non-rebreather, air entrainment, anything other than a nasal cannula, guys. This is a bubble humidifier, and that is going to add moisture to your oxygen, helping with that drying out because of the flow, because it's a dry gas. You're adding moisture to it. That's what a bubble humidifier. So again, bubble humidifier at 4 liters or above always, but always recommend if you do see some patients are having some discomfort or some problems with the nasal cannula at any level before 4 liters. Comfort, right? Always comfort, guys. All right, so nasal cannula, like I said, the benefits of it, if the patient needs to eat, they can tolerate the low to oxygen, right? Because this is FiO2, low FiO2. It gets kind of up there, but then we'll go to simple mask if it's medium or non-rebreather. And you'll catch that in the other video. But nasal cannula, solely nasal cannula this video, liter flow and FiO2. That's what I want you to unpack from this video. 1 to 6 liters adult liter flow, and then here's what it represents. 1, 24, 2, 28. How do you chart that? You don't chart it in percentage, you chart it in flow. Why? Because it's an estimate. I keep repeating these things over because I really need you to know that, and this is really going to help you in the future, your test taking, clinician, all those things included. So once again, thank you for watching the nasal cannula video, and we'll have more coming out soon. Keep watching, like, subscribe, keep building. And you know what, guys? Put in the comments, what do you want to see? I'm going to start doing this now. I'll start producing these videos. Just start giving me comments. Start letting me know what you liked in these videos, what you see. Okay, guys? So have a good one, and we'll see you in the next one. Thank you.